afternoon, all of you, and welcome all of you again in Empowered Voices. And today we have an amazing woman, Dr. Vidyaa Hari Iyer. She is a dentist, psychotherapist, and a healer. She is doing a lot of work in the field of psychotherapy and in the field of healing. She is a NLP practitioner also, and in 2020 she started her venture Get In Get Fit, and here she is working on 7 verticals. So she is an amazing woman, and let us know about her journey as a dentist, as a healer, and a psychotherapist. Welcome you, ma'am, in our Empowered Voices. So welcome you, ma'am. And my first question is, how do you explain the concept of energy healing and to the people or patients?
Okay. So basically, if you look at a human being, we say, we are heart, body, mind, and soul, right?
Yeah.
So energy healing is so very, amalgamated into our everyday life, and healing also matters that way. In 1948, when World Health Organization, when they defined health, they also said that, health is just not a physical state. It's not a state where you say, okay, I don't have a particular disease. They said it is an amalgamation again of the physical, mental, emotional, psychological, financial, and social well-being. So considering all this, basic parameters that we check in health industry, energy and the aura along the person matters a lot. So whenever a patient comes to us or a client comes to us and we try to find out their the history, the reason why they have come to us, we always find that they come to us for some kind of a pain issue, being a doctor, right?
Yes.
So when they come to you for pain, we need to have a holistic approach to them. It is not just the pain at a particular specific point that they are trying to tell us. So it can have deep-rooted cause. For example, being a dentist, if somebody comes and tells me that, I have a decay, right? So
Right.
obviously, as a dentist, if I'm only going to treat them as a dentist, then what I will do is I'll clean up the decay, I'll fill it up with a material, and then they're good to go. But then, if I look into the energy levels and find out, why have they not maintained their teeth? Then you will have many more questions as to, they are not motivated enough, or they don't know they have to brush their teeth twice daily, or, they are just lazy that they don't brush the teeth in the night, which is very vital. So I come to know a lot more about the person or the persona behind that person who's sitting in front of me. So when I heal them from all aspects, that is when I'm able to give a complete reply or an answer or a solution to their problem. Rather than giving them just a temporary relief, I give them a permanent solution. So that is how energy actually helps me in treating or, helping my clients have a 360-degree approach to their life.
Yes, ma'am. Ma'am, my next question is, in your experience, how does oral health, as you mentioned now, relate to overall mental and spiritual well-being?
Oh, that's a wonderful question. So usually, Garima, when you hear about some quotes, they really touch you. One such quote is by Ogden Nash. He said, some pain is dental, the rest is mental. And being a dentist and also a psychotherapist and a counselor, I get to help my patients or my clients on both these, genres of work. So when you take about dental health, we generally say mouth is the gateway of the body, which means if I have problems anywhere else in my body, I will have the manifestation in the oral cavity. Let's take, for example, some lifestyle diseases like, say, diabetes. I'm going to have gum problems. Even physiological changes like pregnancy, you will see there is a gingivitis or, gum infection and inflammation. And you'll sometimes see even gum inflamed so much that they call it a pregnancy tumor. Nothing to do with cancer, but just that it is so huge. So if you look at oral health, it is so very vital, and it becomes like a mirror to the entire body. So if I say that, dental health is very important, especially as I told you in diabetes. I can even take an example of a cardiac patient or a heart, affected patient. So the same microorganisms which we see in the oral cavity is seen in the heart valves.
Oh.
So it becomes very important. There are so much of connection between brain problems, Alzheimer's, and so many things that we always understand that oral health is so very important. It is the mirror, as I say, it's the entry point of a lot of physical, body problems. And understanding this is very vital, and creating awareness amongst, general public is also very important, because usually if I lose one teeth in the front, I will go to a dentist because
Yes.
it's in the front. It is
Mhm.
more for aesthetics or look wise
Yes.
rather than for form and function, which is biting and eating and all. But if I'm losing teeth at the back, because my lips and my cheeks cover it up, patients sometimes are not motivated enough.
Mhm.
However, things are changing. People are getting a little more aware, and they come to us. However, if you look at the percentage of the population of India versus the number of people who are actually getting, the exact kind of treatment which they ought to get, the ratio is still not very nice when you look at it in the global level.
Mhm.
So mouth is the gateway of the body. Any systemic problems you have in the body will get reflected in your oral cavity. So sometimes your doctor will be able to identify and take down what is the problem actually, and then give you the right kind of solution. So suggest you to other specialists who will be able to help in this manner. And this is very vital because most of the patients who come to you are still in the era where they come to you for consultations and opinions. Of course, 50% of the patients go to Google and, find out their answers themselves. And they come and, try to instruct us or tell us that this is what it is and, this is how it has to be. And with Chat GPT and all, I think no AI has taken a
Yes.
upfront in this. However, having said all these latest technologies, still the dentist has a role, and, it is so very important that the patients are aligned with the doctor and their advice, and then they get treatment done. And they are very grateful, they're very happy, and they are very concerned, and they refer a lot of other patients. So it becomes, when you actually treat not only the problem but the patient as a whole, you also make them a friend for life, or the family becomes a friend for life. So that's how it becomes.
Yes, ma'am. Ma'am, that's why in India we are not concerning about dental health more regarding other things, regarding other body problems. Just if we are having pain in our teeth, just we take medicine and we will not go to the dentist. If a huge problem, if more pain, then we will go to the dentist. So because we are not taking this dental thing so seriously, and most of the people not doing brush in at night, and without brush they go to sleep. My next question is, ma'am, how has your understand of body mind connection evolved through your years of multidisciplinary practice? Because you are a dentist, because you are a healer, and you are a psychotherapist also. So how you understand mind body connection?
So let me tell you how and why I, got into the different kind of genres of holistic health. So initially, I obviously did my dentistry, and then I had patients where I was serving them for dental issues. But over a period of time, they started, interacting with me, and they found solace in probably the suggestions that I was giving them. And one such patient, a long time ago, way back in 2005, 6. So when she came up to me and then she asked me for some other, specialist referrals. And when I actually referred her and, put her to another friend of mine who's a concerned specialist, and she came back to me and I asked her whether she was comfortable. And then she said, ma'am, you know what? You have a knack of talking. And I was so happy with what you said that I followed, and I'm happy today. So this triggered me to learn psychology, and then I did my MSc MPhil in psychology, and then slowly I realized that psychology again is treating patients who have an issue, and they come to you, and they have to be open to share it with you.
Yes, sir.
Then I stumbled up upon neuro-linguistic programming, or NLP, that they say, even without the patient completely sharing about their own thoughts that they want to, still we can heal them without, actually getting to know the origin of the problem with the neuro-linguistic programming, or NLP. And that became a mind through change for me, because, some patients are hesitant to say, maybe they feel we'll judge them, not us,
Yeah.
but people
Yes,
have
sir.
judged them.
Yes,
So
ma'am.
when they come for professional treatment, or when they come for professional guidance, they are not very open about it.
Yes.
They're still skeptical to find out if we are really going to live up to what they expect us to do. So bridging the gap, I learned even art therapy, where, I am
Okay.
an art therapist also, where I decided, when I work with abuse patients, especially sexual abuse and, child abuse cases, I realized that, some of the children might not even know how to communicate.
Yes.
Forget that if they don't want to communicate.
Mhm.
So I learned this art therapy because I can help people uh, take out or let out their emotions, especially the negative emotions, and maybe of fear, of frustration, of anger, of hopelessness, of being unloved, all of those. And I realized over a period of time that, these therapies were going deep down into people's minds, and it was helping them even better sometimes. And of course, being a pranic and a Reiki healer and practitioner, I realized that, even a lot of unfinished tasks that we have in our mind with people, or, with anything, which sometimes can turn the individual into a bitter person. Rather than becoming better with time or experience, sometimes we become a bitter person. And all that together, I realized that, occult sciences, or the healing energy science, when integrated, when amalgamated into the mainstream way of approach, then it becomes what is called the care and cure model of treatment. So care is how we can take care of people, and cure is how medically we can, help them. So both of them, if you ask me, is important. I can't separate one from the other.
Yes.
It is so very important, and I can only be grateful to God that I have learned and understood the importance of both. Because
Yes.
sometimes an allopathic doctor might not, you know, understand the importance of the other aspect. But today,
Yes.
with a lot of healing, energies, and a lot of other prayers and a lot of things which comes along with treating a patient, people have slowly been accepting the fact that we need to give a holistic approach. When I say holistic, it also means WHOLISTIC and HOLISTIC. So holistic and
Holistic.
holistic, both of
Yes.
them. And this is now creeping into all aspects of medicine, not only in dentistry, in all aspects of medicine. If you look into a hospital also, the moment the patient becomes a little all right, they're giving them, a lot of physiotherapeutic exercises, and they themselves say, go for your yoga, go for a morning meditation, go for some pranayam or breathing, so that, it becomes a kind of a lifestyle change. And today, I
Yes.
think majorly, all of us are going through what is called the lifestyle crisis,
Yes.
right?
Yes.
Because of our long or improper eating and not sleeping properly, and a lot of other things that, whenever we have to treat a patient, we need to look into different aspects before we actually give them a kind of a solution. It's not a ready-made or a tailor-made thing, no. So we need to look into different parameters to help each client of ours feel important and give them exactly what they're looking for.
What role do you see technology playing in the future? Integration of conventional medicine and a holistic healing procedure.
See, AI is good. It's always a boon or a bane, right? Anything for that matter. We cannot shun down any advances in any field of medicine or any field of life too, right? So there are a lot of advantages when you look at AI creeping into medical field, and it is very important for us to know where to draw the healthy boundary between the robotics and human intervention. Whatever said and done, the kind of care, the kind of love, the kind of attention, the kind of, the way you speak and the kind of conversations you can have, being a patient, a doctor, or a nurse and a patient, or a family, caregiver and the doctor. You cannot, what should I say? You cannot disconnect all these and say only AI will work. There will never be a time like that. So 50% of AI intervention is very good. It makes our life simplified. And 50% of the human touch or the human care, the empathy that a human being can show towards one another, the kind of touch. They say, a touch can heal. So the healing touch, the kind of words that you speak, the kind of attention that you can give. Maybe somebody just needs a hug to brighten up their day. Sometimes they see you smile and then, you also smile along. Sometimes just a pat on the back saying, hey, you're good, you're healing well. That might itself trigger and, the patient might want to feel better. So these kind of positive strokes are so very important. And I don't think AI can do that.
Yes.
So AI has its own importance, and a human intervention is equally, or if I can say, 51% of human intervention with 49% of AI. That would be the perfect match, because both of us are very important, and it is best that we embrace technology. At the same time, we understand the importance of a human being. God has made us, and when he made us, I think, he has taken so much of care to, make such wonderful human beings, you and me, right?
Yes.
And because of us, the world is so beautiful. If it was only machines everywhere, I don't think people would be happy living in that world.
Yes.
So there is a need for machines. There is a need of AI and technology and all whatever is happening. But at the same time, having that the Midas touch, as I would say, is very important.